factors,
Yeah.
also how they influence a person's health, whether there was any way to even prevent someone who ends up in this state. And that was why I then ventured into this particular specialty, where we are really looking at a more holistic approach, where we look at not just the medical part, but also the social aspects, the mental well-being aspects, where they're all important to someone staying healthy as they grow older. So then that was the start of my specialization. I think another area that then as I did my specialization, I also had this opportunity to work in the Ministry of Health, and in this particular office called the Aging Planning Office. And I think that is something that has a bit of relevance to ASPIRE55 as well, because over there we were really looking at then, I think in continuation to why I even embarked on this journey, how do we help people to age well? How do we help people to age in a way that is different than what we currently observe? When I joined that office, I was really excited because the mission of that office was, it was driven by this lady who really was passionate about helping seniors, and we all worked very hard, but that passion really shone through, and it really made us want to support that cause. And I was really excited when I got the opportunity to join that office. I think in a nutshell, what she wanted to do was really to change the conversations and the perception around aging. I think maybe just about 10 years ago, a lot of times when we look at aging, people think about nursing homes, they think about these sort of like really depressing sort of associations. But right now, I think we have come to also realize that, the way that we age can be very, very different. And I think ASPIRE55 is really a testament to, how someone can really age and age well and in a very happy and fulfilled manner. And I think, I digress a little bit, but really a lot of when I joined the office, it was really how do we support the population as they start to grow older, to age well in a way that I think you and me would want to age when we are 50s, 60s, 70s, 80s, and not in a way that is that puts pressure on ourselves, but really how do we see ourselves how do we want to live our lives when we are older. So as part of that stint, I actually we did many focus group discussions with different groups of seniors in different places, and really wanted to understand what was important to them as they age. And it was very, very interesting because it was not necessarily things that I had expected or experienced in my life before. And I think there were a few common themes which I will summarize here that drew to me. One was that health was really important, but that in itself is not an end goal. People want to stay healthy because there are other things they still want to do in their life. They want to firstly be independent. They don't want to be a burden to their children or their loved ones. They want to be able to care for themselves. Some of them want to stay healthy because there are things that they still enjoy doing and they want to be able to continue to do that. So they have a certain purpose that they want to fulfill. They want to enjoy what they are able to do. And some of them, of course, want to stay healthy because perhaps even as they're aging, they are caregivers to their parents. There are needs that they need to fulfill. And it was interesting because as a medical practitioner, very often we are very fixated on health itself as an end. But speaking to many different people, you realize that health is one part of their lives, but it's not the end goal. That there are many other things that drive someone and makes them motivated, and that you have to understand them as a person first before you can help them to improve their health or to stay healthy. And it's really, really about understanding what their underlying goals are, what their underlying motivations are, and how then health fits into that. And that's also why we decided to found NOVI Health. So I met my two co-founders, Dr. Suento and Dr. Jane after I left the aging planning office, and we were in NUHS. And I think we all came from different backgrounds, but the underlying philosophy that we shared was that as I shared through these different stories that I had, was that there are a few things that we felt were important to keeping someone healthy and to keeping someone fulfilled. One is really getting to know the patient as a person and not just as a patient with a health need. What is this person under beneath these medical reports that drives this person? What is it that is important to them? We know that is really important, especially in management of a chronic lifestyle disease, which is what we're talking about today. Because a chronic lifestyle disease is something that's going to be with you for the rest of your life, in a sense. And if you're just treating the medical condition, you're not understanding the person as an individual. It's really difficult then to help the person manage that in a way that is sustainable. So getting to know the patients in the person is really important. And I think what we realize is that in the current construct, in the polyclinic, in the hospital, there are time constraints. The nature of the system is different. We're trying to optimize for efficiency. It's not possible to deliver the sort of care that we envision would be helpful or meaningful to the people that we want to serve. Secondly, we realize also that in the hospital or when we're practicing, very often it's very much touch and go. We see them in the clinic, we give them some advice. Once they go out, we sort of lose that line of sight with them, and we can't guide them. And very often, in a very busy clinic, I have 5 minutes to 10 minutes. There's only so much I can deep dive into, and a lot of it, it'd be nice to be able to follow up, after that. And thirdly, I think, while we are medical practitioners, there are other aspects that we always want to bring in: the nutrition aspect, the diet aspect, which I think it's really, really important when you're trying to stay healthy. And also, I think what we talked a little bit about, the social and mental wellness aspects. And that's why we then decided to start NOVI, because we recognize what is important, and we really wanted to bring all of that together, but it was really difficult to do so in the public system.
Yeah, it sounds really good. Can you share with us? We know that when we age, we read a lot that everyone should probably have their own geriatrician, but this is a new area. I mean, for many of us here, it's the first time we're hearing that we need to see a preventive health specialist. So let's take, for example, I have an uncle who has high blood pressure. How would you help someone like him that would be different from what a geriatrician would help him with?
So, I mean, that's a very interesting question. I think when you want to manage high blood pressure, almost any doctor that is trained will be able to manage it. Managing high blood pressure using medication is not difficult. There are a lot of protocols, and you will be able. Almost anyone will be able to do it. I think a geriatrician will do an excellent job of doing it. But again, I think it's looking at the approach that we want to take to each condition. So I give you an example of someone who comes in with high blood pressure, and what we would do a little bit differently. So I think if you have high blood pressure, the main concern that you may have is why is my blood pressure so high? And I think one of the very common questions I tend to get is, if I had to start a medication, am I going to be on it for life? Right?
Okay.
And very often, I think my answer to that individual would be, well, it really depends. If you wish to make certain changes to your lifestyle, you want to lose a little bit of weight, we can actually potentially start you on the high blood pressure medication for now, because it's so high. We need to make sure that it's under control. But maybe if you really want to work on it, we can potentially take you off the medication if you lose a certain amount of weight. And there I have a couple of patients. It's a trade-off, right? Being very motivated to want to put in the amount of hours to exercise, to control your diet in a certain way to lose that weight and to cut down on the amount of salt that you're taking, versus popping a pill. So some people are very happy. They tell you, you know what, I don't want to think so much about it. I want to enjoy the food. I want to just be able to enjoy the food with my friends and my family, and I'm happy to take a pill for the rest of my life. And that's perfectly fine. But then for some people, they are very concerned about the side effects of medication. They maybe just don't want to take medication, and then where our value add comes in, because of the way that we practice with a team of nutritionists, and we work with partners like ASPIRE55 who help with the fitness aspects, so that if someone actually is motivated to want to get off the medication, we can help them with the weight loss. So we actually have quite a few patients who manage to maybe lose about 5 to 10% of their body weight, and their blood pressure goes back to normal, and they're happier for it. But again, like I said, if you want to really just pop a pill, we can also do that. So really, it's I guess what we do a little bit differently is we try to tailor the treatment or the approach to managing that chronic condition in a way that is suitable for your preferences and what your goals are. And we bring in the appropriate expertise, nutrition, fitness partners like yourself, so that the person can actually achieve those goals if they want to.
Yeah, I think we're seeing a new trend, and this could be a trend driven by a very new generation of people who are aging today compared to the previous generations. People who are a lot more interested in knowing the impact of the food they eat and the choices that they are making, whether they want to exercise or not. And I think most importantly is they see the potential that if I work hard at looking after myself and I exercise and I eat well, I could possibly be off the medication in future, but there's always a trade-off, right? Yeah, And I find it a lot easier to motivate people of my parents' age than people of my grandparents' age. What's your take on this?
I actually see that same trend as well. I think the people of your parents' age, so I guess that's about 60s maybe, around there.
Close to 70.
Okay. I think the older generation, that maybe 80s or 90s, very often they're very used. If you have been eating a certain way for 80 years of your life, to ask you to make those changes at 80 years, when you're so used to it, you're so comfortable with it, I think it's going to be a big challenge to do that. So I think in general, it's a little bit more difficult, and I think for them, if I'm ill, I'll take a medication. That's always been how it's been, and I think they're very much used to it. But that being said, there are some that have a little bit of a different mindset, and they're willing to experiment with different, like functional foods or even different ways of eating. I have been surprised by myself. I recently saw someone who was 70 something, and she started taking avocado, and I was like really surprised, and she was messaging us to ask, how do I prepare this avocado? Because she has diabetes, and part of the reason we had trouble controlling her sugar was that her breakfast meals tends to be what we eat in the hawker center very often, like a big plate of fried noodles or bee hoon, which is all carbs, and it's going to cause your sugar to go very high. So then I said, okay, maybe you can have bread with like tuna or maybe avocado on it. So I was just bouncing ideas out, and I was really surprised that she was actually open and she actually started taking avocado, which I didn't expect that. But anyway, the point is that I think those that tend to be a little bit older, generally they maybe are less they probably view medicine as what they should be taking, but I think with the younger generation, many of them are a bit more wary about what they put into their mouth. So in terms of medication, they're very concerned about side effects and whether or not there's something else they can do to mitigate this.
Well, I've got a question for you on the area of preventive health. We talk about medicine, but let's talk about the other side. How about vitamins and supplements? What role does that play in looking after our health?
That's a very good question, and I think that's something that we focus a lot on as well. So I think in general, the teaching has always been that if you are eating well, you're eating a good balance of foods, there is no need for supplementation or nutrition, additional supplements. But actually what we are finding is that, I don't know if this is something that we noticed, and there are quite a few studies that show that the same apple that you ate maybe 10 years ago versus the apple that you eat now, the nutritional content is actually a lot less. So it may have, like an apple 10 years ago may have this amount of vitamin C, but the apple now is going to have a lot less vitamin C, and it's got to do with the way that agriculture is being practiced right now. And so you may be eating the same sort of food as you did 10 years ago, and you may be having enough nutrition then, but you may not be getting sufficient nutrition from that food now. The common deficiencies that we tend to see in older folks include vitamin D, partly because vitamin D is a vitamin that you need to go in the sun to make, and I think a lot of older folks tend to avoid the sun. It's quite fun. Sometimes to go out, you use an umbrella, and also I think in Singapore it's just generally so hot that you don't really want to be in the sun for a prolonged period of time, and that has a big impact on your health because vitamin D is important in osteoporosis prevention. So when you start to get older, that's a big risk that we see in a lot of older folks. And I think many of the people that come through who do health screening with us, we do see that that's something that's a little bit deficient, and it's something that can be easily supplemented. In addition to that, I think the other supplements that are key and important will be your calcium. It will include things like your omega-3 because we don't really eat so much fish, especially deep sea fish here like salmon. I think some of you may, but not everyone does. And these foods these micronutrients are a little bit less easy to get through your general foods. So in general, what we do is that we'll sit down with someone and we will look at their dietary history and see where are some appropriate supplementation that makes sense. But I think in general, the ones that tend to be more important in our population will be maybe vitamin D, sometimes even fiber because we just don't eat enough fruits and vegetables. And for older folks, this is not a supplement, but protein is very important because as you start to get a little bit older, your muscles start to shrink. And a lot of people don't eat a lot of protein here, and without that sufficient amount of protein, your muscles will tend to shrink even faster, and you start to feel very tired, very lethargic, and you sometimes get a bit weak. So that it's important to make sure that the diet actually is able to address some of these things.
Yeah. So if it, you look like a very filial grandson, and seeing that you've talked about your grandparents earlier, if you were to walk into their bedroom today, what kind of vitamin pills can we expect to see that they are taking? What would you as a grandson recommend to older people to take?
Unfortunately, I think my grandparents they're already taking a lot of medication. So they're not really keen on taking a lot of supplements at this point in time. But I mean, if I could, definitely what I would put on the table would be a general multivitamin, which basically supplements most of the different vitamins that are needed. I would give a magnesium tablet because that's something also that tends to be a little bit deficient, and then a vitamin D and calcium combination, and maybe fish oil. Yeah.
So how and thinking about a couple of these vitamins, how much of the vitamins that we take are absorbed into our system rather than being passed out? And what's that? I mean, obviously we can get a bit more vitamins through these supplements rather than through some of the foods because it's so difficult. But how much is actually retained in our system?
It depends a lot on the formulation and also the types of on the types of vitamin that you are taking. But generally, about 20 to 30% will be absorbed when you take it. But the vitamins are generally formulated in a way so that if you take that tablet, it will sort of meet your minimum requirements of what your body needs to function.
Yes. Oh, good. So we've got some questions that have just come in. So we're going to take a couple of questions from the audience. They've asked this question: if I go to a conventional GP and just for my regular checks, usually the doctor sees me for 10 to 15 minutes, as you've mentioned to us earlier. So it's really quick. They don't really have much time. But if we come and see you at NOVI Health, how long is the average consultation, and does it mean it's going to cost me many, many more times because I'm seeing you? Like if I see you for an hour, it'll be 4 times the consult of a normal GP.
Right. I mean, that's a very good question. I think our average consult time, I would say, is between 30 minutes to 1 hour in the clinic itself. So that can, so I mean, it really depends on how much we have to chat about. in terms of the consultation price, we actually are benchmarked to a specialist clinic. So we don't actually charge you more than any specialist that you are seeing outside. And I think even at most specialist clinics, you're not going to get such a long consult. And very often we have the nutritionist or dietitian also together with us to help you with some of the other questions you may have, like what you're asking about the vitamins as well as the different types of food that they're taking. So in terms of, I think value, we definitely, I feel at least that we deliver more. And that's because really we strongly believe in the mission of taking the time to get to know that person and also bringing a more holistic model of care to that.
Mm.
Yeah.
Can you tell us more about the journey of a new older client who joins NOVI Health? I mean, how do you explain to them exactly what do you do and how you will help them? And how often will they come and see you in order to see some changes in their health? How fast would it take for some changes?
So again, it really depends on person to person, but generally, I think within say about 3 months, we will be able to see quite significant changes already for someone with say chronic disease. I can walk you through a journey of someone who comes to see us, and then you get a sense of how things could quickly or slowly things could change. So someone who comes in to our clinic, generally the first assessment will be, of course, with the doctor and the health and the nutritionist. And we try to make sure we understand, what is it that you do on a daily basis. We understand your medical conditions. And then after that, we try to then also take stock of, what kind of medication are you on already, whether there's any room to maybe optimize it or adjust it, or if you're doing perfectly well, stick to that. Thereafter, most of the time, if someone is keen to make certain lifestyle changes, we actually support them through that. So the moment when they come into the clinic, we actually have an app which is fairly easy to use. It's just basically messaging and allows you to log food within there so that we get a better sense of what you're doing. Then after, when you leave the clinic, we actually continue to follow up with you every few days, just so that we can give you that kind of guidance that you need to make certain changes to your goals. For most people, for example, if you're trying to lose weight, maybe about, I think what we've seen is that quite a few of our patients, maybe within, say, a period of about 3 months, they can lose up to 5% of their body weight, which very often is enough to make a big change to, say, if you have diabetes, to your diabetes control. And if you're talking about, say, for example, sugar control, if you make the changes to your diet and you're able to make them quite quickly, you will see the improvement definitely by the next visit in 3 months' time, because the contribution of diet to a condition like diabetes is actually a lot. And if you are able to make those changes, you are actually able to see the results very, very quickly.
So what are the top conditions that you see the most at the clinic, which are also probably the top chronic disease conditions?
So the top conditions that we see primarily are diabetes and hypertension, or high blood pressure, and high cholesterol. So those would be the I think amongst the population, especially elderly population, the most common sort of conditions. We do, of course, have healthier people who just come for health screening and maybe they just want to lose a bit of weight. We can help them with that as well. And of course, other related conditions like osteoporosis, etc.
Growing up with older people around me and grandma, I've always felt that growing old was almost associated with getting all these chronic diseases, and you hear of them taking their blood pressure medications and this medicine and that medicine. It's almost like people accept that as they age, they're going to have all these chronic diseases. And you mentioned earlier that these are all lifestyle based. Can you elaborate more? Is it possible for me to age without having all these conditions?
Yeah, so I think you're right. A lot of these are associated with aging. So many of the chronic conditions, there are different components that put you at higher risk or cause it to develop. So I mean, there are the non-modifiable factors like increasing age, and of course genetics, right? So like if your parents have some of these chronic diseases, you may be at higher risk. But that doesn't mean that there's nothing we can do about it, because there are actually a lot of modifiable, what we call modifiable factors that contribute to development of these diseases. And the primary factors will include your diet, what are you putting into your mouth every day, how much physical activity or exercise you're doing, and of course, things like smoking and alcohol. If you look at maybe say 50 years ago versus now, right? 50 years ago, we don't hear of so many people developing high blood pressure, diabetes, whereas now it's like everywhere. And why is that? If you look back at how we have evolved as a society, there are a few reasons why we see so much more of that now. I think firstly is the rapid urbanization, which has a few consequences. One is that we've become a lot more sedentary. We don't walk as much as before, and that tends to make you put on weight, right? So weight, we know, is a very strong risk factor for all these chronic conditions. Secondly is the type of food that we eat. In the past, we don't have all these industries producing a lot of these processed foods like your instant noodles, your chips, your snacks, and even your refined carbohydrates, which is what we find in the hawker centers. The diet has changed so much that it has contributed a lot to the weight gain, and also it has also contributed to people developing diabetes. And I think part of that is driven by economic forces, because there is so much demand for these different things. They become the cheapest food option, and that's why it's so prevalent and so common that it's the easiest thing to get if you want to, and it's even cheaper than you preparing your own food, right? And because of all these changes, I think it has really resulted in a change in how we age. And then thirdly, I think the change in types of jobs that we do now. A lot of us are desk bound. Last time we may be in the farms, in the factories, spending. All these contribute definitely to increased risk of putting on weight and developing risk factors. And that's probably why we need to take a little bit more care now to make sure that we don't, we eat well and we still keep our weight under control, and then we move to be able to keep these diseases at bay. So not necessarily that if you age, you will get these. I mean, there are a lot of older folks that don't have any of these conditions, and really what you can do about it to keep that under control.
Yeah, I think what we're curious about also is to learn from you, because you're young, you're a doctor, and you know all about preventive health. How is your lifestyle a little bit different and more encouraging for us to follow? Can you tell us your typical day and what you eat and how you shop? What are the food choices that you make? And what kind of activities do you do?
Okay, yeah, okay, I must be the first to admit that I'm far from having the ideal diet. But I think I practice what I preach. A lot of it is in moderation. So it's never about, restricting yourself so much that you can't enjoy life, because that's never going to be sustainable. And that's why a lot of people have yo-yo diets, right? They make it so restrictive. You can't do this for more than even a few months, and then you go back and relapse. So I think personally for myself, I think exercise-wise, I found a sport that I like to do, although the last 2 months, obviously, we can't do any of that. So I enjoy playing tennis, so then that gets me the sort of cardio or aerobic exercise that I do a few times a week. And then what I'm cognizant of also, especially in older folks as well, is the strength training, the resistance training exercise, which I think ASPIRE55 does very well, which is very important, especially to maintain muscle mass, which keeps a lot of diseases at bay. The increased muscle mass actually reduces the risk of diabetes, and also it helps with bone strength, which is important as you grow older, where you're at high risk of osteoporosis. So I've tried to incorporate a bit of strength training, but it's not something that I really enjoy. So I'm also having trouble sometimes staying motivated doing that. But yeah,
so maybe we'll invite you to come join us at the clubhouse to exercise. Yeah, you can drop by during lunch hour. And what do you eat? What do you eat for breakfast, lunch, and dinner? What's your typical plate like?
Okay, so breakfast generally is quite light because I'm always in a rush. So it's like black coffee with maybe a yogurt and a bit of fruit. Try to make sure that I at least get some protein in, because that keeps you a bit more full, and it lets me have enough energy till lunch. I mean, ideally, if I had time, I would like maybe make some eggs as well, but I don't really. I can't wake up in the morning. Then lunchtime, usually because I'm at work, it will be trying to look for healthier options. I try to eat either a salad or maybe something like, I don't know, like with like some leaves and some meat lah, because I tend not to eat so much carbs at lunch because that tends to make me very, very sleepy by 3 o'clock, and I can't really function when I have that brain fog. So I try to eat something that's a bit lighter for lunch. Then dinner varies. Like if I'm cooking, then it will be a bit healthier. But sometimes if you go out with friends, then it might be a bit of an indulgence, like a steak with some what I enjoy, and then maybe a bit of dessert. But yeah, I try to make sure that I don't do that too often because yeah, not too healthy. But yeah, in general, I try to make sure that I get enough greens and meat in my diet.
So what's your take on those things like no sugar diet and no carbs?
Again, if you can do it, that's great. But in general, it's really difficult to be able to sustain it. So it's not about going to extremes. So I think for carbs, there are always healthier options that one can take. They are less refined that are perfectly fine. And each food group has its own micronutrients that are unique to it that you would benefit from. So completely cutting out carbs actually can cause you to be deficient in certain nutrients. So especially magnesium and zinc, for example, if you cut out carbs, so people on keto diet are especially prone to having these deficiencies. So my take is always choose a diet that you can sustain, that works for you. There's no one size fits all diet for everyone. And it's really making small changes around the diet that you're consuming that you can live with and that you won't feel deprived.
And I think many people talk about intermittent fasting, and it's a common thing that we hear of, and sometimes when we hear of it, we go like, maybe you want to check in with a health professional first before you embark. But what's your take on intermittent fasting for diabetic patients who are on medication?
Okay, so intermittent fasting in itself is not a bad thing to do because when you're fasting, there are physiological changes within your body, and you produce, and it can actually be good for someone with diabetes. The only complication is when you are on certain types of medication that can cause your blood sugars to go low. And if you're not eating any food during that period of time and you're on this kind of medication, it can cause your blood sugars to go dangerously low, and then that's when you might end up with some complications and it can be dangerous for you. So it's often important to work with a doctor or healthcare professional that's able to take that into account, take your lifestyle into account. So if you want to do intermittent fasting, or in fact, even when you want to make certain drastic changes to your diet, like cutting out a lot of carbs from your meals, then adjusting the medication to make sure that it's tailored to your lifestyle, it is important because you don't want to end up in a situation where you're both cutting down on the amount of carbs that you're taking, which causes your sugars to go down already, and then you still take a medication that makes your sugars drop. Then you end up in a situation where your sugars are so low that you end up in the hospital, and that's what we don't want to end up with.
Yeah. So we want to really be careful on that. So it's good to seek some advice. Another question on diabetes, and you can tell that diabetes is a hot topic here. Do diabetic patients usually lose weight over time? Is it common as they age that they would lose weight?
Not necessarily. So typically when you get diabetes, at the start, in fact, you may lose weight because, especially if it's uncontrolled. And then very often what happens after that is that a lot of individuals start to put on weight, partly because of the medications that they are put on. So some of the medications have, because they cause your body to produce more insulin, which is a hormone that causes you to put on weight, then you end up gaining weight. You don't very few patients would start to lose weight because of diabetes. If that happens, then you probably should you should probably have a discussion with your doctor as to why, because there can be so many reasons why you're losing weight. And unintended weight loss is definitely a red flag, what we call a red flag, something that needs to be investigated to see whether there is any dangerous cause that we need to look out for.
Okay, great. Thank you so much on that. Well, we have more questions about medications here, and it pertains to, and especially now because we know that older people are also looking after other older people. So there's two generations of people at the same aging at the same time. So, you know, mom could be looking after grandma. So we have a question here. Her mom is 88 years old and she's on medication for high blood pressure and high cholesterol and aspirin because she had a minor stroke a few years ago. And these medications may have adverse long-term effects. How can we reduce her medications over time, and should we?
Okay. So I mean, because I don't know the specifics of the case, I can't really
Yeah.
speak to this particular patient in itself. But I think in general, so I'll speak in general terms.
Yeah.
I think for someone who has had stroke, so certain types of medication like aspirin have been shown to be important in preventing a second stroke. It reduces the risk of getting a second stroke. So there are a lot of scientific trials. While there are side effects of aspirin, like for example, you may have increased risk of gastric bleeding, for example. What the evidence shows is that the risk-benefit ratio, whenever we start someone on a medication, it's always evaluating the benefits versus the risk, or the risk being the side effects. And it's been shown that there are more benefits than harm that is caused. So therefore, it's routinely prescribed as something to prevent or reduce the risk of a second stroke. As to high blood pressure, high cholesterol, for those really, again, it comes down to how well can we control those conditions. If we're able to do it through diet, then of course we can stop the medication or reduce the amount of medication they're on. But if not, because this individual has had a stroke before, they're at high risk of getting a second stroke, then in terms of the risk benefit, you would want to keep these conditions or these risk factors under control so that they don't get a second stroke, because that could be fatal.
Yeah. Okay. That's very good advice. So thank you very much for that. You know, let's talk about the things that impact us in our lives today. And I think one of the number one impact is stress from work or stress from people around us, or you know, the nature of what's happening out there. How do you see the role of stress as a contributor towards lifestyle diseases, and how can we manage this better?
Yeah, so stress is actually a big contributor to lifestyle diseases. I think in a few different ways. Firstly, if you're under a lot of stress, from a medical point of view, you already tend to produce a lot of stress hormones. These stress hormones have been shown, if you prolong exposure to these stress hormones, they can cause a lot of other chronic conditions, just purely because. So for example, when you're stressed, right, your blood sugars already tend to go much higher than normal. So then, that's in a sense a little bit like having diabetes. And if you constantly are under stress, then that's going to be very high. And of course, when you're stressed, like you tend to be tired all the time. You don't have the mental energy or the capacity to do a lot of things that are good for you. For example, choosing the right types of food or dedicating a bit of time to exercise. So then there are all these peripheral side effects that happen that causes your health to deteriorate. And then thirdly, I think stress is a very big contributor to poor sleep. And we know that lack of sleep or poor sleep is a major risk factor for poor health. So stress in itself is definitely something that has a big impact on development of chronic diseases and management of chronic diseases.
I think sleep is a great topic that we should touch on now. What time do you sleep?
I try to sleep about 12:30 to 1.
What's your recommendation on the amount of sleep we should have, and what time should we go to bed?
The recommended amount of sleep it depends on your age, but I think for someone that is about 60 or 50 and above should be between 6 to 7 hours if possible. If you're younger, you need more sleep. So like someone below 50, probably about 7 to 9 hours. And then if you're a teenager or kid, even more. As to the recommended bedtime, there's no specific time, but what I would recommend is that you go to bed about the same time every day, whether you are working or not working, because that helps to build some kind of regularity into your schedule, and that helps you to fall asleep a little bit easier.
Good. Thanks. Well, we know how we should adjust our sleep patterns slightly. We do know of some older people who feel a bit stressed. They try to sleep at 10 and they just really can't fall asleep. So maybe the idea is to sleep at 12 every night. And if you can fall asleep better at 12, just go ahead and do that.
Yeah.
Well, so many questions have come in, so let's take some questions now. About 2 years ago, one of the questions here said that they started learning about negative health impacts of having a leaky gut. After eating healthier, she's experienced overall health improvement, and she doesn't need medication anymore. So through her diet and nutrition, she seems to have changed that health status for herself. She asked whether or not medical schools teach about nutrition, and how much do they teach? What is the impact on a professional doctor that emerges from medical school? And is that why doctors are tuned towards medication and clinical approaches?
Yeah, no, I think this is a very good question from Deborah. So it's true that in medical school, we generally don't learn a lot about nutrition. We learn a lot more about diagnosing certain conditions and also around using medication to treat. And that's why I think in our practice, what we do a little bit differently is we make sure that we have the appropriate expertise. So the dietitians and the nutritionists who spend their 4 years really learning about food and how it actually impacts the body, so that we bring them in to help to look at those aspects that I'm not an expert in. I recognize that yes, this is important, but I'm not the one that has gone through 4 years of learning about how food impacts the body. So that's why we recognize the value of the dietitians and we bring them in where needed.
Yeah. So when you meet your peers, fellow doctors, and they're all in different specialties, do you see a greater attention and focus now being put on preventive medicine?
I think so, because partly it's got to do with also what the government has been doing. They've been looking a lot more at chronic diseases and how to prevent that. So I think the focus has sort of shifted as well. So right now, there's definitely a lot more emphasis or awareness, I would say, on these areas.
Great. We've got a question on diet, about the whole food plant-based diet. Right. And is there any potential nutrient deficiency we should watch out for apart from vitamin B12? And what you think about the whole food plant-based diet?
Okay, so the whole food plant-based diet, I think it's a diet that's gained a lot of popularity the last few years. Some people go on it because of environmental reasons. Some people go on it trying to lose weight or trying to eat healthier. I don't think there's an issue with it, but there tends to be a bit more difficulty in getting the whole spectrum of nutrients. So I think a few different, I think the question was around what nutritional deficiencies tend to happen. So besides B12, there are certain amino acids that are only present in certain types of plant food. So if you don't take a wide spectrum of plants, you may be lacking in certain amino acids. And amino acids are building blocks of your protein or muscles. So then there could be certain deficiencies. The second thing is around iron. If you are taking plant-based foods, generally they tend to have a lot less iron in them. So then, if you're not taking sufficient amounts, you may get what we call anemia, which is low blood count. And there are a few other nutrients that tend to be a little bit more difficult to get unless you eat a good. So it's not impossible to get it through a plant-based diet. You just need to be deliberate about what you're eating to get that. So for example, soybean would have most of the amino acids that you need, but if you're focusing on other beans like just lentils or chickpeas, you may not get that whole spectrum of amino acids that you need. So it's important to make sure that you pick the right things to incorporate into your diet or do supplementation.
Yeah, that's good. Well, we've got some questions on, and since you're a preventive health specialist, we want to make full use of that to understand the conditions. Yeah. We have two questions here. One is about how can we help women who are pre-menopause to manage this better through their lifestyle? And the second question is, if someone is considered pre-diabetes, what can be done to prevent it? So both are prevention of onset of conditions. So can you explain each?
Okay, so I think for pre-diabetes, that's a very good question, and it's actually the best time to catch yourself if you have pre-diabetes. It's the best time to reverse it, because that's like at the earliest stage of physiological abnormalities of processing sugars, and it's the best time. It's the time where there's the highest potential to reverse it and not requiring any medication. Actually, I just had one person. I mean, he's fairly young. He's about 40 years old. He did his health screening with us. I found that he had pre-diabetes, and what we did with him over months, he managed to reverse it already. So his weight was actually already normal. So we didn't even need to make him lose weight, but it's really just around what he was eating. So you must understand why you get pre-diabetes. Very often, essentially, it's just, you have this organ in your body called the pancreas. It's like the factory that produces insulin. Insulin then sort of stops the sugars from going too high when you eat certain foods. And you can imagine when you start to stress your body by eating a lot of sugary food or a lot of like carbs, like a lot of noodles, after some time, your factory will become very tired. It's like, I don't want to work anymore. It doesn't produce anymore. And then your sugars start to go higher. And that's at the early stages, there'll be pre-diabetes. If that progresses, then you get diabetes. So the way to sort of reduce the stress on your body will be, of course, to change your diet. And at that point in time, that's why it's important to then make modifications, cut out certain foods that tend to stress your body in that way. Not to say you can't have it at all, but really to just make minor changes to that. If you're overweight and you lose some weight, then your body actually responds better to that insulin. Then your body doesn't need to stress about producing so much more insulin. And then through both cutting down on the stressors and also making your body respond better to whatever insulin you're producing, you're able to already reverse that pre-diabetes. So definitely, if you have pre-diabetes, that's something that can be reversed, and it's probably the best time to do something about it. Yeah.
Yeah, that's great. How about premenopause and menopause? How can you help women to manage this better?
So I think for menopause, right, very often there are certain symptoms that you can develop, but those very often do not. A lot of it is having strategies to be able to manage that so that it doesn't disrupt the life that you have. But I think importantly, from the medical point of view, very often for women transiting between premenopause and menopause, there are certain conditions that suddenly become a lot more prevalent. What happens when you go into menopause is that the amount of estrogen that you're producing, is going to decrease, and then it puts you. So some of the things that like protect women from developing certain diseases as compared to men, for example, heart disease, that protective effect then becomes less, and you need to then pay more attention to maybe picking up some of these risk factors for heart disease, for example. And of course, the other thing that's quite common is your bone health, because once your hormones start to drop, the risk of developing osteoporosis becomes so much higher. And that's where it's important to do a few things, to do your strength training exercises regularly, to maintain your muscle mass, and also to make sure that you're taking sufficient calcium, vitamin D to keep your bones healthy. And then thirdly, of course, is to do regular screening to check your bone health, to make sure that it's not deteriorating, and you need maybe to do something even more drastic to protect yourself.
Yeah, that's great. And if you guys stay to the very end, we have a surprise promotion that we'll be sharing with you later if you're interested to know more about how you can improve your nutrition through the changes in your lifestyle with NOVI Health. We have time for a couple more questions, and these will be the last few questions. One of it is on the impact of genomics and DNA, and how does it help us to remain healthy? Can you tell us more about this area? We hear a lot about doing the testing these days.
Yeah, so I think that's an increasing area that there's a lot of interest in. I think to understand how genomics can contribute to health, it's going to take me a really long time to explain, but I think I'll just explain what are the users that have very clear scientific evidence. So I think if you're looking at a disease like, say, cancer, right? There are two types of cancer. There's one that is very clearly inherited from, say, your family members. So the very famous case would be with like Angelina Jolie with the BRCA mutation for breast cancer, which means that once she has that gene, she's going to have a like 90-something% chance of developing breast cancer. So for those, it's very clear cut that there is a gene that they can identify clearly that causes this sort of cancer. There are other types of cancer that are also inherited in this way, in the colon. And we have systems in the healthcare system to say that, hey, if we diagnose someone with this, we'll inform the other family members to quickly go and get tested for these genetic mutations, and we will need to do a lot more aggressive preventive treatment like mastectomy to remove the breast so that you don't develop that breast cancer. The other sorts of diseases like, okay, so your other types of cancer where you have a higher risk of developing cancer because, you know, maybe your mother or your grandfather had this kind of cancer, those are not inherited in such a clear-cut way. So those are what we call, they tend to have multiple mutations in many, many different genes, but just because you have that mutation doesn't mean you're going to develop that cancer. It's an association and not a direct cause of that cancer. So whilst there are a lot of these test kits out there which allow you to test for these different sort of risks, how we interpret it is a little bit less clear because it's not a direct causation. It's like, okay, I have an increased risk, but very often, how do you act upon it? How do you use that information to make any changes? So it really depends. So, I mean, if you find that maybe you're at higher risk, you may want to take more proactive lifestyle changes to reduce your risk further, because that genetic component, you can't really make any changes to it. But those test kits, I mean, there are a lot of them out there, and they do test all different things. But it's how you interpret it that makes it that's very important. Yeah, there are differences.
I think that's why we always need a medical professional and to tap on Dr. Carl to maybe help us to analyze all these reports that come back in. We have one last question that we want to ask you before we end today's wonderful session. And although we haven't managed to answer all the questions, we'll try our best to answer them later on the ASPIRE55 blog after today's webinar. So we want to end today's session by asking you, what does the 100-year-old life mean to you?
Oh, that's a very interesting question. I think for me, it comes down to a few different things. I think firstly, I think purpose. So I think even as I grow older, or like if someone grows older, I think it's important. I think at different stages of your life, different things are important to you. But I think having something that makes you want to still get up in the morning every day is very important to me. So, even living to 100, I think that's something that I feel must be there for life to be meaningful. Secondly, I think related to that is still having that meaningful connection with different individuals, whether is it your loved ones, your family, because I think especially the older you get, I think these relationships become even more important because these people are people that have been with you for that long period of time. I think thirdly is still being able to stay healthy and independent, because I think life is more meaningful when you are able to do the things that you want, when you are able to still be able to be independent, because I mean it's not so meaningful if you have to be very dependent on someone else. Yeah, so I think
I think that's a very well thought of and it's a great ideal that we can all aspire towards. And we hope that everyone here with us today and in the community, we can all be together in this journey to make our health better and to put in the time and commitment to improve our lifestyle and to make those changes. I mean, I wouldn't want to be 100 and still having to rely on many different medicine bottles. Hopefully we can all be there till 100, living life, enjoying the activities we like, and having the mobility and independence. Thank you very much to everybody who's joining us today. If you'd like to catch a copy of this video, it's still on Facebook, so you can like and share and invite all your friends to learn more about chronic disease management and how to better manage your health through your lifestyle. Thank you very much, everyone.
Thanks, Janice. Thanks, everyone.
Thank you. Thank you. Have a good afternoon.
Bye.
Bye.